Are regenerative treatments like PRP or stem cells or exosomes, are they reasonable options for a patient with long-standing plantar fasciitis in her feet? My name is Dr. David Geier, triple board certified orthopedic surgeon, sports medicine specialist, and anti-aging and regenerative medicine expert. I help you feel, look, and perform your best regardless of age or injuries. As always, in all my videos, everywhere in social media, I am not giving you specific medical advice. It's meant for general information and educational purposes only. Also, when we're talking about regenerative orthopedics, regenerative medicine, these are treatments considered experimental by the FDA, in some cases used off-label, but generally experimental. So I am not promoting them or telling you to do them in any way. I'm just putting the information out there, trying to explain what they are and how they might be helpful at some point, where we are on the research and things like that, to give you a better idea if this is something you might want to think about and might want to talk to your doctor about. Just understand that up front. But this is an exciting advance, potential advance in the treatment of plantar fasciitis, and that is these regenerative treatments, PRP, stem cells, exosomes. If you've ever had plantar fasciitis, you know that stabbing heel pain can be extremely painful. Millions of people deal with it. Vast majority of people do well, get over it pretty quickly, but the small percentage, 10, 15%, that don't get better quickly, that's where regenerative treatments offer a lot of hope. Again, plantar fasciitis, it's not really an inflammation. It's microscopic tearing or degeneration of an area of the plantar fascia where it attaches to the heel bone. Plantar fascia is the thick band of tissue running along the arch of the foot, goes all the way from your heel to your toes. Typically, this is thought to be an overuse problem. People that run a lot, people that do a lot of standing or walking for their jobs. It's thought to be related to things like tight calves or tight Achilles tendons, maybe improper footwear, maybe excessive weight. Typically, the pain's worse first thing in the morning, first steps in the morning, or after sitting for a long period of time. And for the small group of people that it doesn't get better early on, this can be something that drags on for months and months. Typically, the treatments, things like rest, ice, stretching exercises, sometimes orthotics, anti-inflammatory medications, physical therapy, those can be effective and work for, like I said, 80 to 90% of people. The problem comes into the people that it's not working. Sometimes people will try steroid injections or cortisone shots. I think that's a terrible idea because it very likely weakens that tissue, even makes it more likely to rupture. And surgery is not necessarily a great option either, especially releasing the plantar fascia, because it has a lot of long-term effects. And so for these chronic plantar fasciitis cases, this is where regenerative treatments may be helpful. Also in the setting of and one of my friends just did this, but where you have a plantar fascia rupture or partial tear, that's where regenerative treatments might be very helpful, basically harnessing your body's natural healing ability to try to get that plantar fascia tissue to heal, not just mask the pain or treat the symptoms. The most common option in this realm is platelet-rich plasma or PRP, and that's what I have the most experience doing. Basically, we draw a small amount of blood, take the syringe, put it in a centrifuge, spin off the red blood cells, concentrate the platelets and their growth factors, and inject it directly into the area of disease or degenerative plantar fascia, right off the heel bone on the sole of your foot. I will tell you on the front end, that is a very, very painful injection. You can do lots of little things to numb the pain, but at the end of the day, it definitely hurts. But in terms of what that PRP does, it's releasing growth factors, trying to stimulate collagen production, reduce inflammation in that area, and try to get that plantar fascia to heal. And it actually has pretty good success rates. Studies have actually shown that with randomized control studies, that in people that just aren't getting better with the sort of the standard treatments, PRP can lead to a significant long-term reduction in pain, improved function, even actually repair that plantar fascia tissue when you look at it on ultrasound. So definitely can be a good option. Along the same lines, stem cell therapies or exosomes may be even more advanced than that, trying to work the same way, injecting it directly into that area of plantar fascia right off the calcaneus, trying to get that plantar fascia to heal, trying to reduce inflammation. And I think exosomes especially might do that very well. With stem cells, you're typically talking about harvesting bone marrow from your hip and using the stem cells in that, or you may get it from adipose tissue or fat, and then injecting it directly there. There are some early studies from that showing improved pain, improved function, but we need more data for sure. Longer term studies done with larger groups of people against controls to see what's potentially helpful. Again, the vast majority of people with plantar fasciitis do very well with the simple treatments. And honestly, a lot of those people probably do better with just the rest. But if you're not getting better, and this turns into a very chronic problem, especially when steroids might make the problem worse, especially where surgery might actually not be a reasonable option, that may be where regenerative treatments like PRP, like stem cells, like exosomes may take that one step further and be much more likely to heal. But again, you have to remember these are considered experimental by the FDA. They're not covered by insurance. And so there's something that you have to think about. Again, not promoting them. I'm just giving you the information. But for somebody, and this might be you, long-standing plantar fasciitis, this could be worth talking to your foot and ankle surgeon about. Now, I've written an entire ebook called the Arthritis Solution, albeit it pertains to way more than just arthritis, but I talk about a number of regenerative and non-regenerative treatments for a variety of orthopedic injuries. You can get that free by clicking the link in the description below this video. If you have an orthopedic injury and you want to hear about options other than surgery and other than cortisone, click that same link in the description under this video, fill out the contact form, and learn more about scheduling an appointment to see me. I'd also love to hear your experience with your injury. Leave those in the comments below this video. Just understand if you leave a comment or leave a question in those comments, I can't respond with medical advice, but sometimes I record videos in which I answer those questions. Make sure to subscribe to this channel, click the bell to be notified when I release a new video, and when I start my Ask Dr. Geier live shows. Thanks for watching. I look forward to helping you feel, look, and perform better than ever.